You are tuning in for a MyEllevate and MicroLift, the latest innovation and combination treatments. Have you ever noticed how nice your face looks when your hair is pulled in a ponytail, your skin is pulled tight, and your fine lines begin to smooth? Well, many women have done this and they've asked themselves, why can't I look like this all the time? I know I for sure do. So today, Dr. Miller is going to break down the latest techniques available, including MyEllevate and MicroLift. You'll learn when and why surgery might be a better alternative and when there's non-surgical options that might work. So whether you're actively considering a treatment or you just want to learn, we're very happy you came here today and you can hear right from Dr. Miller himself. So before I hand this over to Dr. Miller, I want to remind everyone that we do have an exciting prize today for 2 people that sign in for the webinar. So please stay on till the end. We'll announce it as it gets closer to the end. And lastly, let me introduce the one and only Dr. Philip Miller. So Dr. Miller is considered one of the top facial plastic surgeons in America. He's particularly noted for his expertise in facial rejuvenation and rhinoplasty. So not only is he an internationally recognized double board certified surgeon, but he really has a beautiful way of blending art and science with innovation and skill to provide thousands of patients with impeccable and reliable results. We try and show you many of them on our social media. So I hope you're all following us there. The preservation of natural beauty is the core of Dr. Miller's practice, and he has a proprietary natural look process, which is very interesting and maybe something we could talk about in a future webinar. But Dr. Miller is really passionate about all aspects of facial rejuvenation and transformation. And today he's definitely one of the most well-renowned facial plastic surgeons in the United States. So without further ado, Dr. Miller, please take it away. Oh, we can't hear you yet. One moment. Wouldn't be a normal Zoom without a little audio mishap, right, guys? So while we are doing that, if anyone wants to post in the chat and say where you're from, you can do it anonymously just to me. I love seeing where everyone is.
We're all set now, Risa.
Oh, perfect. Thank you, Dr. Miller. All right.
You're very welcome. Okay. So first of all, thank you so very much, Risa, for that great introduction. I also want to thank everyone for coming tonight, and it's very exciting. We had a lot of people who had RSVP'd for this webinar. What we decided to do, as you may know, is that we wanted to give a little thank you to those who are interested in these procedures. So if you are interested, at the end, you can go ahead and just in the Q&A session, I think Risa will tell you in the Q&A session, you can just give us your initials or something, and that way we can provide the sort of little gift that we have for 2 special people. We can give those to the people who are actually interested in getting the procedure, as opposed to people who may not be. Not that there would be anyone who isn't interested. I also am grateful, Risa, for being on time. And tonight, hopefully the talk will only be around 20 minutes or so. We look forward to hearing your questions. By all means, please just go ahead and write your questions down in the Zoom section and we'll be able to answer it. So without any further ado, I want to talk tonight about MicroLift and MyEllevate. And what are those 2 procedures and how are they different? Well, the MicroLift is really about rejuvenation of the midface, elevating more of the cheek region, improving the jawline, maybe effacing this area here called the nasolabial fold. Whereas the MyEllevate is an area where is a procedure where we're improving the neckline, we're improving the submental fat period, we're improving the jawline, we're recontouring this region over here. And so that's the main difference. The upper 2/3 of the face, as you can see over here in the MicroLift, and in the lower neck region for MyEllevate. So what do both of these 2 procedures have in common? Well, they're absolutely non-invasive for the most part. They can be done under local anesthesia. They're done under less than 1 hour or so. There's a minimal recovery period with minimal discomfort, and it lasts for years. We're going to go ahead and start right now with the MicroLift. And what is a MicroLift? A MicroLift is a 1-finger ponytail lift. It's that facelift that you can do when you stand in front of the mirror and you take your fingers and you sort of pull with 1 finger. You see that great looking result. Now, if you've got a lot of extra skin on your face, then you're going to see a lot of pleats, and you may not be a candidate for that. But If you can do with just one finger and you like the result, you're a candidate for a MicroLift. Now, I mentioned if you're using 2 fingers, if you're using maybe 3 fingers or 4 fingers, then you're not necessarily a candidate. But a MicroLift has minimal incisions because there's minimal skin excess. And you may ask, why do I have a bunch of trees down here? I'll explain that in just a second as I further explain exactly what it is we're doing, not only with the MicroLift, but in facelifts in general. So when we talk about facial rejuvenation, we have to understand that the face itself is composed of many different layers. You've got skin on the top, you've got bone on the bottom, you've got several layers in between. But we don't want to just lift the skin. Why is that? Because skin, as we get older, loses elasticity, right? So if you stretch something that isn't elastic, then it loses all of its form, and it becomes, in skin's case, very wrinkled. When you're young, you can stretch it, and then when you relax, all the skin sort of falls back into place. When you're older and you stretch it, well, you get wrinkles. So even though we can cut off or remove a lot of the excess on a facelift, if you keep stretching that skin, it's just going to stretch back out again. So we need to do something differently. And that's where we work not on the skin, but on a layer below the skin called the SMAS. And the SMAS itself has 2 different layers. It has a superficial layer and it has a deep layer. Now, you may have heard of the deep plane facelift. That's taking advantage of the deeper layer of the SMAS, but we can actually take advantage of the superficial layer of the SMAS. And here's why, okay? Because there are different excursions. There's different ways in which the SMAS planes move, right? The superficial part of the SMAS moves a lot, whereas the deep part of the SMAS doesn't really move at all. And this explains why I was talking about trees. Because if you think about a whole bunch of trees coming together, forget about that warning for just a second, but if you think of a whole bunch of trees coming together, the top parts of the trees, they can move a lot, right? They can move from side to side significantly, whereas the bottom portions of the trees, particularly the trunks, those are sort of rooted and you can't move them. You'd have to actually cut them, pick them up and move them. And that's the sort of the foundation for the deep plane facelift, actually getting deep and moving things. But you don't need to do that in every single case. Instead, you can work on the more superficial layer. And this is a little disclaimer here. I am going to show you a little bit of a graphical image. It's in the operating room, but there's really, I'm sure if you've seen Game of Thrones or any other kind of television that's on prime time, this really won't bother you. But what I want to show you is the following. Here you go. On the left-hand side is a woman, and I'm grabbing on this side over here, where I'm pointing now. That's the superficial SMAS that I'm grabbing. Whereas on this right side, it's the same SMAS, but I'm grabbing much deeper. And you see, when you're grabbing much deeper, you can't really move it that far, right? That's why if you grab the more superficial layer, you get a really great advancement. You get complete movement of the face. You can improve the jawline. You can move up the cheek. You can get a significant improvement. Now, granted, you also have to make sure that you don't have a lot of skin excess when you do that.
Dr. Miller, we're doing a MicroLift.
Here's an explanation of what I'm doing.
Yep, feeling great.
There we go. Under local anesthesia, and we can just lift the whole face through a small little incision just like that. That's a MicroLift. Okay, and we are done with the MicroLift. All right, you can't even see the incisions. How does it feel?
Feels fantastic.
Yeah, you can turn towards me, smile. Excellent, good, good, good. You look amazing. Turn the other way. You can see the other way. And you can see that great jawline now. And again, the incisions are hidden right here in the hairline. And that looks fantastic. Thank you.
And here she is immediately post-operative. You can still see the incision line is healing, but it's hidden in the hairlines. You see improvement in the mid-face with cheek volume. You can see the jawline itself has also been improved. Again, these are patients who do not have a lot of skin that needs to be removed, and that's why we can make such small incisions and get such impressive results. This individual has a lot of volume right in the lower mid-face. It's the wrong place to have volume. We want to have it up here in the high mid-face, and that will also improve her overall jawline. As you can see also by the three-quarter view. You can get an improvement as well as an improvement in the jawline and even up in the cheek region, high up in the cheek region as well. And this is the patient who I showed you earlier where we were getting an improvement in the nasolabial line here. You may not necessarily get it in every single case, but you can see it in some cases. But clearly, she's starting a jowl. She has a little jowl over here, but that's been improved. And again, this overall volume that you're seeing here in the mid face has been improved, and you can see she has better cheeks as well. This is a patient who we actually contacted and we said, hey, you mind if we use your pictures? And she wrote back today, the past couple of days ago, these are an early post-operative result, but she wrote, hey, 4 years after the procedure, this is what I think. I'm very happy with the results. Though my results have lasted all this time, I am considering having something done when I turn 40 because my problem area is the jowls, and as natural aging progresses, I can slightly see them returning. I know results aren't forever, especially when it's done very naturally and minimally, but I am definitely happy with the results. It gave me new confidence. And that's what we're, for the most part, I'm really seeing a very high satisfaction rate with this procedure, the MicroLift.
So the incision has been made.
And we're going to see another case.
And this is the layer beneath it called the SMAS. So I'm going to grab that and look how fascinating this is. See what kind of movement I can get here? That's going to give me the most movement. It rejuvenates all the way down to the neck. I get neck.
You can see that there's a lot of extra skin here, though, but I'm going to fix it in a very unique way.
Once I move this up here, then I just have to close this incision. You get excess skin here, but I'm going to treat that by just repositioning the ear back like this.
Why would I reposition? This was an interesting case. It was a patient who actually wanted the MicroLift, but also her ears were sticking out, and she asked me to do something called an otoplasty, which is to fix her ears or pin her ears back. So I was making an incision behind the ear anyway, and I said, you know what? This works perfectly. I'll do the MicroLift. Even if you have some excess skin in front of the ear, I'm going to just reposition the ear backwards anyway, and I'll go ahead and be able to get a better repositioning of that area. So you again see an improvement in the jawline. You can see great improvement in the cheek region. And here's a very early 7-day post-op improvement in the neckline as well as in the cheeks. So what is the MicroLift? The MicroLift is a small incision facelift under local anesthesia. It takes about 45 minutes. It's minimal to no pain. The head wrap and bandage is on for around 24 hours. You go back to work in 24 to 72 hours with natural looking results, and you can see the results immediately. That's the MicroLift. Now, let's go ahead and talk about the MyEllevate. The MyEllevate is, again, working on the more lower third of the face, and particularly in the neck region, though it does improve the jawline as well. But it's actually a combination of 3 minimally invasive procedures. It's fat removal using traditional liposuction, it's skin tightening using a radiofrequency treatment, and it's muscle suspension and jaw definition using the MyEllevate device. Let me give you a brief introduction of what this actually is.
Hey everybody, it's Dr. Miller. We are doing a great case today under local anesthesia. How are you feeling? You ready to go?
Yes.
Okay, let's take a quick look. You can see beautiful woman, great facial features, but the neck is just a little full here. Doesn't want to undergo a complete facelift or neck lift operation, so we're going to do a little submental liposuction here, as well as MyEllevate. So we're going to now put this little cannula in here, and then that
this is the liposuction part.
Liposuction out.
This removes all of the fat.
Sort of very unpleasant looking fat that's inside the neck.
And we just sped this up so you don't have to necessarily see all of that.
Now start with the MyEllevate device, and we're going to just enter it right in here. And that's it. Believe it or not, we're done. And put your head down just a little bit, head up just a bit, and then this is swelling, but we now have this beautiful line that we didn't have before. Permanent suture that's completely being contouring the neck, as well as a little bit of liposuction. How was that? Not bad?
Not bad at all.
Great. And so I didn't really explain the MyEllevate procedure,
hey
so I'm going to explain it now.
I'm very excited to introduce you to a brand new procedure we're doing here called MyEllevate. It can be done while you're awake. You're awake, right?
I'm awake.
She's awake. We want to make sure everything is done properly and sterilely. But the patient is completely awake, and it's a very quick procedure in order to get rid of those lines that are, or bands that you can see on your neck. as well as any kind of sagging skin, so that we can tighten up that area. It only takes around 15 minutes or so. Here's really the secret sauce for MyEllevate. It's this fascinating little device that has a light on one end, a string in the middle, which enables me to tunnel the device underneath the skin and more or less thread this thread along the undersurface of your neck and chin to give you contours that you want.
So I just put it through individual small little holes. They're not even incision lines.
And that's it. So it was just a matter of threading that up and around, tying it underneath here. And after liposuctioning as well as tightening this area, we have a beautiful cervical mental angle.
How was it?
It was great.
No problem?
Pain,
Yeah.
no pain. I feel fine. I can go about my business other than wearing this, which I will eventually have.
I have to tell you, I think it's a fashion statement. I really do.
I'm setting a new trend.
I think it's a new trend.
Okay, so here she is. This is one of my early cases. So you can see there, and this is only maybe a week or so out. So she still had some skin that needed to contract a little bit here. She would have been an ideal candidate for really an actual face or neck lift, but she wanted something non-invasive. She's very active. She wanted to be back to work and back doing what she normally does in a very fast pace.
Hey everybody, it's Dr. Miller. We are doing the MyEllevate device. It allows me to put this fiber optic device underneath the skin and place a permanent suture to make the neck nice and tight. Watch how I do it. All right, so I've got the suture in, and now you can sort of see how
Isn't that
I'm
interesting?
able to really tighten and give a really nice jawline here, as well as ultimately when I press this in, this whole neck up here is going to get tight as well, and give her a brand new jawline and tight neck.
Great.
Hey everybody,
Here's her post-op.
Hey everybody, great case for post-op Thursday. Take a look. This individual was just 1 week ago, had a recessive chin, had a neck that was full, lots of extra tissue. She is now just 1 week later. You can see the great definition of the jawline. You can see a great definition of the neck, as well as the under area here. The chin is forward. She is just 1 week post-op, a little swollen, a little bruised, but she's just going to keep looking better and better. I can't wait to show you her in 1 week from now.
Great. I'm going to just stop for a second, if that's okay, because I saw that there were a couple of questions and I want to answer them real quick. How does this compare to a D-plane facelift? The answer is, if you're going to see a great result using this, then there's no reason to get a D-plane facelift, because the D-plane facelift is really going to give you a similar result. Now, I'm not saying that this is equivalent to a deep plane facelift. What I'm saying is, if you see the rejuvenation that you want with your one finger, right, then, and you're not seeing any improvement by doing 4 fingers, the 4 fingers is sort of simulating a deep plane facelift. The 1 finger facelift is simulating the MicroLift. So I'm simply saying, if you're not getting any more improvement with 4 fingers as you are with 1, there's no reason for you to get a deep plane facelift. And no, I am not using threads. This is my MicroLift. I use permanent sutures. I can add threads sometimes if patients want particular regions of their face, but no, this is an actual facelift using permanent sutures. It is permanent. It is not a temporary kind of suture that you would find with threads. You cannot do the Elevate on arms. It looks like someone just asked that. And I'm going to continue with my presentation. Hello, JS. It's great. Thank you so much for being here. I appreciate it. And I am going to just continue with the presentation right now. You can see her. This is her now 3 months post-op. This is absolutely one of my best results. You can see the fat has been gone. There's improvement in the jawline. She did get a chin implant as well. There's no doubt about it. I want full disclosure. So we also had the an additional procedure in this one, and that's sort of what's fun about this, is we can tailor the procedure specifically to you.
Dr. Miller, and we are post-op Mondays. You know, MyEllevate neck definition is not just for women. Take a look. This is a great result. Gentleman came in. He had a little bit of a retrusive chin. chin. He had a neck that was bulging. He wanted more definition. Here he is now 3 months post-op. We went ahead and put in a chin implant. We did the submental liposuction, the MyEllevate platysmoplasty, give him a really, really nice definition of his neck, protruded his chin, gave him a nice masculine appearance. Now 3 months.
Yeah, so MyEllevate is not just for women or even young or old. It's for men, and you can sort of see here the improvement that we get for jawlines. And it's for, it's multiracial. It does, unlike certain procedures like a CO2 laser resurfacing, where depending upon your skin type, you can either only be so aggressive or not. In MyEllevate, we can do the entire procedure with very, very limitations based on patient selection. So in short, MyEllevate can be done under local, and sometimes patients do require or request, I'm sorry, sedation. There's essentially punctures, no incisions, with dissolvable sutures on the outside. The sutures that we're placing on the inside are permanent. It takes about an hour. It not only, and I didn't really sort of talk about this, yes, I'm lifting the neck, but I didn't show you this one technique that we even did today, where, you know, those bands that you get in the neck, the MyEllevate device also allows me to cut or lice or split those bands, allowing the top portion to slide up, the bottom portion to slide down, so it can get rid of those bands as well as lifting and supporting the neck muscles. Gives you a really nice definition of the jawline. Swelling can last for around 10 days. The results are immediate, but without question, because we're including not only the liposuction, but the radio frequency as well of the skin, you can get improvements for over 3 months. And again, this is a permanent suture. This is not like one of those thread lifts that you're going to see. So with that, I know I ran through it, but I am so appreciative of your time that I really didn't want to take a lot of your time tonight. I wanted to introduce you to the MicroLift and MyEllevate, and I'm happy to go ahead and explain more to you in a consultation. And Clay would be happy to reach out to you. But I'm so grateful that you came tonight and that you were interested in this. And so I don't want to take more of your time. We're all busy these days. And I'm so appreciative.
We have some questions.
Oh,
we have some questions
okay.
for you. So everyone, please stay on. We have a couple question and answers to get through, and then we are going to do our raffle.
Yes.
So,
yes.
First off, how long does the MicroLift results last?
The MicroLift lasts, well, you just saw that, and that was it really was an unrequested testimonial. So she's now 4 years out and she's still seeing a benefit. She's getting some jowling down here. But I always sort of say, whenever you get a procedure like a MicroLift or a deep plane facelift or anything like that, number one, you will always look better than your twin who didn't get anything done. You'll always look better. But the MicroLift itself can last a good anywhere between 4 to 8 years. It really depends upon your own activity, your genetics, your level of exercise, et cetera, where you live. Are you in a lot of sun?
Got it. That's very helpful. Thank you. So how about age range? A couple of people are asking what's the best age limit, and is 34 too early to get a MicroLift? Oh my Lord. Are you ready for this? And I'm not kidding you. I mean, I can't believe this, but I had recently, I haven't even told you this. I don't know. I had a 15-year-old come in requesting the MicroLift. Now, she also was coming in with her mom. The mom was requesting a deep plane facelift, and the daughter actually just wanted a rhinoplasty. But she said, you know, I saw this MicroLift, and you know what? When I do this, I got to be honest with you, I really, really like the result. Would I be a candidate for that? Now, we can have an ethical and moral discussion about whether or not you should be doing procedures on a 15-year-old, and I usually like them a little bit older than that, but this was an incredibly mature individual who was asking incredibly pertinent, wonderful questions. And I don't really put an age on any of the procedures. I put findings. And so I have done, for example, lower lid blepharoplasty on 22-year-old women who have a congenital a scenario where they're bulging underneath their eyes, what you typically see in a much older individual. If you're 21 years old and you have a hereditary predisposition to it, well, why should you wait? And so we're debating about whether or not I'm doing it on this individual, but she brought it up. I would say the youngest that I've done so far, I think, is around 26. I wouldn't wait. I wouldn't worry about how old you are. I would say,
again, focus on whether or not you like the way something looks. And I would say the same for the deep plane facelift as well. Don't let age be the determining factor. Let the symptoms be the determining factor. And I don't say that just to do the procedure. I also say that to tell you you don't need the procedure. Just because you're 50 doesn't mean you need anything if you look great.
Good point. So someone did ask, is mid 60s too old for these procedures?
Again, a couple of the people you saw were in their mid 60s. Now, would they have been potentially better candidates for a more involved procedure? Yes. Right now, I have one patient who requested the MyEllevate procedure, and I told them, you're really not a good candidate. You really are a neck lift, a facelift, and full neck lift candidate. But she refused. She didn't want it. She goes, I'll take whatever, whatever non-invasive. I want the MyEllevate. And she's the only person I have right now who is pretty she's not, I would say pretty disappointed. She's not particularly happy, but I also told her it's not the right procedure for her. But is it improvement? Absolutely, there's an improvement.
So this is a really good question. If someone does one of these procedures now and then they need a deep plane facelift later, will there be any issues with scar tissue or anything else?
Yeah, I've actually done a couple of deep plane facelifts on individuals who have had this procedure. And I think the most important thing whenever you have work done in areas that have been operated on before is to convey that to your surgeon. I mean, really make sure that you let them know, not just write it down on a piece of paper, just remind them, because it doesn't necessarily make it more complicated, but there are certain techniques, maneuvers, expectations that we'll have going in, knowing that you have had previous surgery. For example, today I did the MyEllevate procedure on a gentleman who had only had liposuction in the past. So I did the liposuction, the radiofrequency, as well as the MyEllevate. But knowing that he had liposuction in the past, I knew that he was going to be very tender, despite my normal injection technique where patients are typically pain-free. But because he had trauma, because he had surgery in this region before, I knew that the anesthetic was going to not diffuse as well. So I put more in to make sure that he was comfortable. So no, to answer your question, it doesn't prevent you from getting any type of procedure in the future. Just make sure your surgeon knows about it though.
Okay, great. That's very helpful. So a couple great comments. Here's someone, Deborah says, great information and amazing results. Thank you, Dr. Miller. I'm dialing in from Orange County, Newport Beach. Can't wait to see you more on Instagram.
Thank you, Deborah. It's wonderful to have you here.
Yes.
Would love to see you one of these days. Deborah?
So here's a good question. What if I have a lot of fat under my chin and on my jawline? Would MyEllevate be enough?
Again, it would be enough if doing the liposuction, the radiofrequency, and the MyEllevate with your skin type removes all of the defects. Now, if you've sort of lost elasticity, then maybe we'll get a 50 or a 60% result, but that also may be what you're happy with. You may not necessarily want to undergo a more invasive procedure. So we're always balancing this concept in aesthetic surgery. We're always balancing the notion of, I want to do something that's less invasive, that has little downtime, that gives me pretty good results. Well, we can do that, but often what you're compromising for that is long-term results and the best result. Now, it also typically costs a little less and there's very little recovery period, but you're not necessarily getting the best result. Usually the best results require typically more invasive procedures, and sometimes with that, more prolonged recovery period, but they last longer and they look better. And that's the general rule. That I wouldn't necessarily say that's for every scenario, but it's a good general rule.
Got it. So this is another great question. The older woman that you showed, she had a chin implant in MyEllevate. She was put under and had surgery. So why not just do a lower facelift on her instead of MyEllevate?
Yeah, that's a great question. And the answer is she didn't want surgery. So she didn't mind the anesthesia. She didn't want the surgery. And I listen to my patients. I really do. I do, sadly, I do a whole bunch of revision surgery. And what I've gleaned most of all when I've done revision surgery, and I mean revision surgery from patients getting surgery elsewhere, what I've absolutely sort of gleaned from that is that most of the time it could have been prevented if the surgeon just really listened to the patient. And if they did what the patient wanted, the patient probably wouldn't be in my office right there. So I listen to them. And if they say, listen, you can sedate me, that's fine, but I don't want incisions. And yes, it did require a little bit of incision over here to slide in a chin implant, but that was a bargain she was willing to do. She didn't want big incisions on the side of her face. She didn't want any type of neck incision. She didn't want anything behind her ear. So that's why that's what determined that factor.
That makes sense. But you do offer a wide range of facelift procedures. Can you speak to that for a moment? If someone does need something more aggressive?
Yeah, sure. In fact, I was down at our international meeting just 3 days ago, and one of the talks I gave was on facelifting approaches regarding or tailoring facelifting approaches. Now, you should know, if you're in this sort of in this market, if you will, if you're interested in facelifting, facial plastic surgeons fall sort of into two different categories. One category is, okay, I'm going to tell you what you need, and I'm going to tell you what you should get, and it's going to be pretty much what I always do. And if you don't want that, then that's fine. Go find somebody else. And that's not a bad approach. I'm not criticizing those individuals. They have a certain, as we've sort of described it, that's a certain artistic sense. It's like, listen, I'm not going to compromise what I think you should get, right? And then you have other individuals, and I personally fall in that category, where I will tell you what I think you need. But that doesn't necessarily mean if you don't want it, I won't do the surgery, or I won't modify what it is that you would benefit from. So I do a deep plane facelift, I do a full neck lift, I do a mini lift, and then I do this micro lift. And they change by how long the incision is, how far forward the dissection is, and the not so much the vector. Those are almost always the same, but ultimately whether or not you are adjusting the neck, the jawline, the mid face, the cheeks, or just any one particular region.
Thank you so much. So a lot of people are curious about cost. So tell us, what do you think these procedures cost?
Yes, I checked with my patient coordinator right before. I said, you got to give me an estimate around this. And he said, it's typically between around 11,000 to 13 or 14,000. And the reason why it's sort of difficult is that I did show you a number of cases where some of them were very minimalistic and all they got was maybe a micro lift. Sometimes they got a micro lift with a laser peel. As I saw, as I disclosed, one of them was MyEllevate with radio frequency and a liposuction, but also a chin implant. So the price does vary on ultimately what you choose to get.
Got it. So hi, Dr. Miller. It's Dawn from New Orleans. Would these be better? Would these be better for me rather than a lower facelift? No.
Let's wait. First, I got to figure out whether or not I can do HIPAA compliance and all that type of stuff, you know. But I would say that there's no doubt a more traditional facelift approach, a mini facelift, is going to give you a longer lasting and better result than these more minor procedures. But I do like these more minor procedures because they work. But again, when it comes to like facelifting, if you can get a really nice facelift with just 1 or 2 fingers and you like it, there's no reason for you to get a 4-finger facelift, which would be something like the deep plane.
That's a really great trick. I hope I'm not the only person trying to look in the mirror now. So can you remove a small amount of skin with MyEllevate and MicroLift if necessary?
Yes, you absolutely can. Yes. In fact, that's for the micro lift where the incision is up over here. I used to actually routinely take out the skin before I realized, wait a second, you know, I don't even need to take out the skin because I'm doing all as I showed you with that tree, right? And you saw on the table that I really was just elevating everything using that superficial layer of the SMAS. And you get scars when you put skin incisions under tension. And skin incisions become under or go under tension when you cut too much skin out and you're trying to bridge that gap by pulling it together. So one of the reasons why I don't routinely take skin out when I do a micro lift is simply because I want to make sure that incision heals absolutely perfectly. But I have no problem removing it if I definitely think that there's an excess. And similarly with MyEllevate, you can do MyEllevate with also skin excision. There's absolutely.
Great. So you mentioned before that the MicroLift and MyEllevate can last about 4 to 8 years. So at the end of that, how far back do you go? Do you look like you did before you started? Does it drop significantly?
Yeah, that's a great question. If you think about it, it's like, okay, when I say 4 to 8 years, what do we mean? Do we mean that you revert to what you look like 4 to 8 years earlier? And I would say no. What I would say is around 4 to 8 years later, you're probably saying, oh, you know what? I want something more. Because you got to remember, you're continuing to age. During that time period, you're also aging, right? It's not as if you had the procedure, you went back 8 years and you stopped aging. So it's typically around the 4 to 8 year period where people come back to me and say, okay, you know what? I'm ready for something else. It might be another minor procedure, or it might be something more involved, but that's the time frame that I'm referring to. It's not as if they revert to what they used to look like, or what they would have looked like. It doesn't advance. So all of a sudden it's like, okay, well, we stopped it. You were 40 for, 8 years, but now all of a sudden overnight you look like you're 48. No.
Great. So can you show more? Some people wanted you to point more to where the mini facelifts or chin lift scars might be.
The chin lifts, or, well, I'll point it out here. And I apologize for the headset in this, but it was the best audio. It always has been sort of the best audio. But so if the incisions always sort of start right here. Actually, you know what? I'll just do it on me. The incisions typically start in the hairline or right in front of the hairline. That would be for a micro lift, right? And then if you take your finger and you pull up, where do you get extra skin? You start getting extra skin in front of your ear, right? So a mini lift would involve extending that incision typically down either in front of your ear or jumping into your ear canal to hide the incision, but often stopping right at the bottom of your ear or just behind the earlobe. That would be sort of a 3-finger lift. And then the rest of the incision often is hidden behind the ear and then in the hairline, so you can't typically see that. Those more of your 3- and 4-finger lift. The incision underneath the chin is if we all sort of take our thumb and forefinger and sort of grasp our chin and our neck and pull it together, there's a natural crease that falls right there. Mine is more natural than others because I fell not once, not twice, but 3 times as a kid, requiring sutures on my chin all 3 times. So I have a very natural, or perhaps unnatural, skin crease in that region. But it heals perfectly as long as you keep it right in that line.
Got it. Okay, great. Thank you so much. We still have more questions going, so everyone feel free to get them in, and then we will do our promotion. So what is the ponytail lift? Is there a difference between that and the micro lift?
Yeah, the ponytail lift and the micro lift are pretty much the same thing. It's trying to create a lift that resembles what you look like when you put your hair in a ponytail. The only difference would be is that when people often like the appearance of, and that's why I'm using the 1 fingers right over here, but that's a little different than this. And if you, when you put your hair in a ponytail, you often sometimes also get more of a brow lift, right? And if you remember, one of the patients that I showed you not only had an incision here, but they had another incision a little bit higher up. So she had what was called a lateral brow lift as well as a micro lift to give her full rejuvenation of the more side, or lateral, we call that lateral, more of the side brow area, as well as the mid face and the face and the lower face as well.
Great. So are there any of us who are not a candidate for MyEllevate?
Absolutely. Those who don't want it. Period. Yeah. I mean, if you've got a great jawline, if you already have a great jawline, if you already have if you have no fat underneath your neck over here and you don't have any banding, so absolutely, I'm not saying that MyEllevate or MicroLift is for everyone. But if you have those and you're bothered by them, then there is a non-invasive solution.
Got it. So can we combine these procedures? Can you combine them with fillers and injectables too? And is that, if you've had fillers in the past, is that an issue?
Not at all. If you have fillers, the only stipulation for that is a lot of times I want to get a sense from you what you look like when you're unfilled. So that may not necessarily change what we do, but I want to get an idea of, you know, should we do more than that? In other words, you might be a great candidate for a MicroLift if you're fully inflated, but all of a sudden, if you're completely deflated, no, you probably needed a 2-finger lift. You see, that's where it can sometimes be a little confusing. And I'd like to see what patients look like without it. But having filler or Botox, these are like putting on Botox and fillers like sunscreen, right? I mean, you should be, that just keeps you going from day to day, looking the best you possibly can, preventative, if you will. And these are procedures to sort of jump you backwards.
Which we all would love. So would you dissolve the fillers if I came in to see you or someone that had fillers?
Yeah, some patients, I do that, absolutely. Particularly, I see sometimes patients who are just overly filled. I dissolve them because I think that they'll look better dissolved in the first place. But other times I'll just take that into consideration. Sometimes I'll get the report from the other treating physician to find out how much was put in where, and then I can gauge what needs to be done based on that. I mean, you paid a lot of money for these fillers, so why dissolve them? Now, I do make some exceptions, for example, and I know we're getting off topic, but if you have filler in your nose, I obviously want that all dissolved before I do like a rhinoplasty. But filler in the face, you've paid a lot of money for that. I don't want, keep it, but let me see if I can augment what's already been done.
Understood. So we have a lot of patients or people on today. They're from out of town. How does this work? Is it complicated if we don't live in New York City or New Orleans?
Not at all. It's so funny. I have a great story. So my sister, she lives up in Boston and works for the Massachusetts Medical Society. And she would always call me and say, you're cutting edge, Phil, my brother, what are you currently doing right now in your practice? And I would tell her, well, right now we're using this technology called Skype, and I'm communicating by this video communications with patients in Europe and patients in all over the country. And I meet with them and talk with them, and then they actually fly in and I do their procedure, and they either stay here in New York for a week, or I just make sure they're okay for a day or two, and then they fly home. And she says, oh, we're going to have to look into that, and we're going to go into committee. And year after year, I would talk to her and I would say, so how you doing with that? How you doing with this whole concept of video conferencing? Well, we're in committee and we're discussing the ramifications. So of course I called her and said, so it took a pandemic for you to turn around and finally say it's okay, we can do it? I said, I've been doing it for a decade already. So it is not a problem at all. I always want to meet everyone, typically on either Zoom, or almost everyone at this point now is a Zoom consult, and then you'll come in and see me either the day before. If you're flying in from out of town, we'll do a full assessment, make sure that we're totally happy with what the procedure is. We do the procedure. I always like to be around for 24 hours or so, at least, maybe 2 days, and then if you're okay, either you can head back home or you hang out for a few more days.
Yeah, Manhattan's not a bad place to spend a little bit of extra
time. Or New Orleans. I'm in both places, remember?
Yes, of course. So this is an interesting question. For MicroLift, how do you make sure the two sides of the face are symmetric? Is it possible my face might look lopsided?
Yeah, you know what? That's a really, really good question. It really is. And I did actually get one patient where I got, now if you think about it, if you get limited movement on one side, the first side, and then you get a lot of movement on the other side, then you're like, oh, wait a second, let me compromise how much movement I'm getting on the second side because I didn't get as much of a lift on the first side, right? But what do you do in the opposite when you get this great lift on one side and then you go to the other side and you only get sort of a limited? In those cases, I've employed a bunch of different tricks. One person mentioned threading, which are these barb kind of sutures. And what that sort of really does is it just allows me to grab down and grab some of that superficial SMAS a little bit further down. So on the side that moved more, there was a connection between where I was operating and the area maybe down here, whereas on this side, that superficial layer stopped a little bit short. But I can still reach that area by using other techniques to make it come up. But naturally, symmetry is key in any procedure.
Absolutely. And I know all of us, any of us that have seen Dr. Miller in the operating room will tell you he spends a lot of time looking at the patient and making sure that it's as symmetric and, perfect result as possible.
And we all know if it's not me, Adina's doing it too. And for those of you, I'll tell you, if you enjoy my company, and not that you would necessarily, but trust me, once you meet Adina, you will want to come back. So a little shout out to Adina, who's my scrub tech right-hand person in the operating room. She's got an amazing eye. And she is your advocate in the operating room without question.
I love that. And yeah, we love Adina. So here's an interesting, is this MicroLift safe to do for someone who's had a successful kidney transplant, but they're still on antibiotics for rejection medication?
Yeah, that's a good question. I would, in scenarios like that, I don't see right now why there would be a contraindication for it, but I would check with your other physicians to make sure that they don't have a problem. I can't imagine. The only thing we're really doing for something like this, we are putting in a permanent stitch. So there's a permanence factor. It's not something that's going to dissolve. And that being said, the face is an incredibly vascular area. You typically don't get infections in the face. That's different than the body area, which has lower vasculature, lower blood flow, and there is a higher propensity of getting infections in the body, back, feet, legs area.
Understood. All right, guys, just a couple more questions and then we'll wrap up here. So can you do a deep plane after MyEllevate? Yes,
absolutely. In fact, in fact, I did one, and this was a challenging one because it looks as if the person went ahead and whoever, it wasn't me, I didn't do the MyEllevate, but whoever did do it, they put a suture in, and I think it must have broken. And then they went ahead and did it a second time, but they didn't take the first suture out. So I'm doing the deep plane facelift, and I see the MyEllevate suture, and I'm like, well, that's interesting, and I just sort of remove it, and then all of a sudden I find another one, and I'm like, well, where did that come from? And I had to take that out as well. Yeah, not a problem.
Yeah, but those are the types of circumstances when it's super great to go to someone like you that has so much experience, because that's probably doesn't happen often.
No.
So you mentioned kind of how long the procedures would last, but is there anything that someone could do to help them last even longer?
I always sort of joke around, look, I can promise you that your facelift will last forever as long as you don't talk, eat, smile, chew, move, go outside, have children. I'm just kidding, my kids. I'm kidding. Look, we got to balance looking young with living our lives and being happy, and we should never really question that. We should always have a really healthy balance, and be fortunate that we're in a position where we can get these procedures, that they're available to us, and that we can get them. But by all means, go live your life, enjoy yourselves.
Yeah, absolutely. So thank you so much. As we wrap up here, I just want to remind everyone that this is recorded. We'll send it out this weekend. So if you have any family or friends that you think would benefit from hearing this kind of education directly from the master himself, you can forward it along. Otherwise, we are available for virtual consultations or in-person consultations in both Manhattan in our office in Midtown and in New Orleans, which is new as of a couple of years ago.
That's right.
So at this time, if you are still interested, if you think you're a candidate and you're interested in discussing further, we would love for you to go to the Q&A and put in your email. And you can make sure that it's anonymous when you click, but they are all anonymous.
Do you want to just make sure that people, just make sure that you want to have their email, or should they just put like their initials and then we can figure out? I just don't want, or just make sure that you explain to people how they can maybe put something in the Q&A and that no one else sees their email.
Good idea, Dr. Miller.
You
So
know?
just put your first name and your last initial so we can see your email from when
Okay.
you registered for this. And if you could pop that in the Q&A to let us know, you know, that you are interested, because we want to make sure that these two $500 certificates go to someone who's actually going to be interested in the procedure, and it will be a great help for their budget. So I'll give you guys a few more minutes to do that. And, you know, Dr. Miller, aside from us going into the mirror and using this 1 finger and 2 finger technique, is there anything else we should do as a next step if we are interested?
Oh, if you're interested, please, you know, just schedule a consultation. Having a consultation to me just means you're more interested in learning about the procedures. It doesn't mean that you're committing to having it done. It's just about education. And then you may be a candidate, you may not be a candidate. There may be other alternatives for you. But I really strongly encourage that the next step would be a consultation, contacting Clay, either at, I think it's, do you remember, I'm embarrassed. I think it's patientinfo@GothamPlasticSurgeryNY.com. That'll do the trick. Or maybe Risa, we'll go ahead and send out an email to everyone about how to do that.
Yes, I will pop that email into the chat right now. And of course, we also have our website. You can actually book online, even though it's a little after hours now on the East Coast. So you can go to our website, drphilipmiller.com, and book online. I will post this in the chat right now if you want to directly email, and otherwise for our contact page. But let's see, here's the last one. So you guys should be able to see that in the chat. So otherwise, we have the list of the people that are interested. For HIPAA compliance, what we are going to do is do a raffle and pick 2 winners, and we will reach out to you tomorrow to let you know and ask if it's okay.
Can't we let them know who it is tonight?
We can. Okay, Dr. Miller.
No,
yes.
I mean, yeah, and just so that people know, the way I looked at it was, we were talking about this, and I said, don't just give it to, don't give it to 2 of the registrants, because for all we know, maybe one of them didn't even come on to the webinar and may not even be interested. Why don't we at the end just ask if anyone is interested, and that way we know we're absolutely giving it to someone who at least has interest in it, rather than just giving it to someone who sort of signed up but isn't really interested, and then it's a waste, as opposed to giving it to someone who may be interested. So
all right,
how about if you do, you know what, here's what I recommend, Reese, if you don't mind, but you tell me, is take a quick look and then see whether or not you can sort of, after you do the raffle, if there isn't like 2 who have maybe the first and last initial, you can just say their initial, and then we can get in contact with them afterwards.
Okay, perfect. I will do that. I'm trying to put it into something right now to make sure that it's a real, true, you know, raffle here. So in the meantime, if anyone else has any further questions, we have just a few more moments here for this webinar, and I am just, let's see.
Yeah, and I want to thank everyone so much for coming. It really means a lot to me. I think there's great procedures, but more than that, you also took the time to spend almost an hour now with us, and that really means a lot. I know how busy we all are right now, so we're planning on doing this again, so please tell your friends and family. We're going to be talking about other topics as well, because we actually had a fun time, you know, preparing for this and coming up with a fun presentation. And my only criticism right now has been, Dr. Miller, slow down, you're talking too fast. Slow down. And again, I was just trying to be sensitive to those who were
Rushing around Manhattan.
Manhattan, or in life with all the other expectations and responsibilities.
Understood. All right. So I am going to announce the 2 winners. The first one is Susan G.
Oh, okay, good. All
Susan
right.
G. And the next one is Eddie P.
Oh,
so
terrific. Well, congratulations to the 2 of you. Risa, just send out an email to them as well. Congratulations, you 2. And I hopefully we'll see you guys soon.
But for the rest of
and
you,
I
of
hope
course,
to see all of you. Exactly.
yeah, we'd of course still love to see you and have a consultation, and Dr. Miller can discuss if one of these procedures or something else is best for you. Just like Dr. Miller said, he's really honest in these consultations, and he spends a lot of time making sure that you guys are on the same page and that he hears you. He's not the type of physician that will just talk to you or at you.
Or as I like to say, I saw this one patient the other day and I said, listen, the next time you have a thought about getting anything done, she's one of the patients, I'm dissolving all these fillers in her face. I said, the next time you want to do a procedure, you make sure you call me so I can convince you not to get it done. Because you don't need anything. You look terrific and you don't need anything. The only thing she's doing for me is I'm dissolving everything that she's had. Yeah.
And we really appreciate that you do that, Dr. Miller. It makes that, you know, it's scary getting any of these procedures for any of us, you know, even a small snip or tuck. And so it's really nice to know we have someone like you to advocate for us.
Risa, thank you so much for helping arrange this, and for April as well, who helped put together the presentations, and Adina and Tanya and everyone else who was just really great. There's a couple of others who I probably would prefer to be nameless.
And yes, Eddie, you did hear that correctly.
Oh, that's so funny.
So do you still have availability for consultations before the end of the year?
I believe so. Yes.
Okay.
I'm not allowed to look at the schedule. That's the one thing there are certain things I can operate. I cannot touch the schedule. I am forbidden to do that.
Perfect. Well, I know for sure that while we are booked out, we will make sure that if you really want to get in this year, that we can make it happen. There's still a few months left, even though I know everyone's already getting ready for their holiday decorations. So thank you again, Dr. Miller. Thank you everyone for tuning in, and make sure to follow us on social media so you hear about the next webinar, because we will be doing this again, especially if this was helpful to you guys. We'd love to hear your feedback.
Instagram, Dr. Philip J. Miller, DrPhilipJ Miller.
Perfect. Thank you guys so much. And thank you, Dr. Miller, for sharing all this expertise with us.
Thank you. Thank you, Risa. Have a good night.
Bye.
Bye-bye.